how do I present different options to parents? I start by making sure that they trust in what I'm about to say and that I trust in what they're asking me back. And once I can see that that trust is there, then we can start talking pretty frankly about things. Any parent who's been through a transplant consult with me will know that I can be pretty blunt at times in terms of saying, here's the best odds I think we can get. I don't believe in sugarcoating things sometimes. I don't believe in just giving everybody an optimism bias. But the one thing that I love about our program here at our center is we don't always just give patients or caregivers an optimism bias. We give you a compassion bias. And that's what I think that all parents and patients deserve is a compassion bias. Once they see that in us, and we truly care about the care we're giving, now we can present the options to them. How do I decide what's the best option? I think as a parent, you would smile knowing that there's a large brotherhood of oncologists, and it is a brotherhood. I have many oncologists that work with neuroblastoma on my cell phone, their cell phone numbers. I email people every week, maybe not every day, but at least every week, I'm emailing a different oncologist around the country about some neuroblastoma issue. They're emailing me. It is a band of brothers in terms of physicians. Whenever I send out emails to my colleagues, I always start it with 3 words, actually 4 words, to my neuroblastoma amigos. We literally call ourselves the neuroblastoma amigos. And it's a band of brothers, of physicians that truly care about what you as parents, what you as a child, as an adolescent are about to go through for your neuroblastoma therapy. So when we go to present the potential options to you, it often means that we've discussed it not only internally within our own group. All transplant teams have internal discussions. They have meetings typically weekly or more to go over patients coming in to weigh the options internally. But we've oftentimes discussed the options externally with our colleagues outside of our own group. You already heard me say that some of our closest colleagues at Ohio State, but we've got really close colleagues I just start naming the centers, CHLA, Children's Hospital of Philadelphia, at Dana-Farber. The list is endless almost. Even within our state, the Detroit Medical Center, the Children's Hospital of Michigan in Detroit, at DeVos on the west side. We're literally a team. All physicians across the country. I'm even thinking of more centers I left out: Colorado, Seattle, UCSF, and San Francisco. The list is going to be endless. Emory, Cincinnati. I'm going to be guilty when I look at this and think, oh, I forgot to mention MCW, Milwaukee. Chicago, where Ami Desai is, Northwestern. We have Cleveland Clinic, Case Western. My goodness, the list is endless. And if any physician watching this says, Greg, you forgot to mention our center, I apologize. UT Southwestern, Baylor, certainly, St. Louis. What you're seeing as a parent listening to this is I know there's an extensive network of parents that talk to each other within neuroblastoma circles. There's an extensive network of physicians that talk to each other within neuroblastoma circles. So when we weigh the options and benefits for you, I think you should know as a parent that we've typically weighed it in our own minds, in our own hearts for your child, even before coming into that consult. I said that you have to have 2 feet on the ground to come into transplant. It's when a child doesn't have both feet on the ground, meaning their disease status may be a little higher than I want, or their organ function is a little lower than I want, that I'll be talking to my colleagues. Hey, what do you think about this? What do you think if we did this? What do you think if we adjusted this? What do you think if I did this? I think you would smile as a parent to know all that talking that's going on behind the scenes, both internally within a center and externally amongst centers, as we start looking at the options for your child in transplant.